listening in all four quadrants. Okay. Also listening at the aorta for any bruise. Feeling the aortic pulse. Okay, and now listening at the femoral arteries, palpating femoral pulse. And listening for bruise there. I don't hear any. Okay, now I'm going to do light palpation on your abdomen and deep palpation on your abdomen. Let me know if you have any tenderness to either the light or the deep.
Okay.
Breathe out to relax your belly. Here we go. Now a little deeper.
Okay.
Breathe out. Any tenderness?
No.
And now percussing the abdomen, which is mostly going to be resonant because of the gas that's usually trapped there. Okay, you have normal resonance in the abdomen. I'm going to feel for your kidneys, which are not easy to feel, and sometimes you can't.
Okay.
So I'm going to get you to take a deep breath in and relax with one hand behind your back and the other one on your abdomen. I'm going to push in. I cannot feel a kidney. Okay, and on this side. Okay, all right. And I'm going to palpate your liver. Sometimes you can feel the liver and sometimes you cannot. I'm going to measure the liver span with percussion in just a moment. Deep breath in. I do not feel your liver. Okay. And then your spleen. Deep breath in. Good. I don't feel your spleen. I'm going to grab a measuring tape. And I'm going to first percuss for your spleen. So I'm coming to the mid-axillary line and percussing for resonance and dullness. Okay, and then take a deep breath in. I don't notice any change. Because I do not believe your spleen is enlarged. And now we'll come and measure in centimeters your liver span. So starting down low, I'll hear resonance here, and then as I come up mid-nipple line, I'm going to hear a change to dull, and that's where the liver begins, and then I'll come down from nipple line to notice the difference there. right there. And then coming from nipple line down. Okay, so that is 11 centimeters, which is in the normal range, 7 to 12. I'm looking at the skin on both of the upper extremities. It's warm and dry and pink. Looking at the nail beds for capillary refill, which is brisk, less than 2 seconds. And clubbing of the fingers, which there is none. And on this side, brisk capillary refill again. Feeling for pulses in the lower extremities and the skin. It's warm to touch. I'll be feeling for the posterior tibial pulse. I'm going to have you bend your knee up. Good. And the dorsalis piece. The pulses are strong and equal in that leg and this leg. Okay. Pulses in this leg are strong and equal as well. Okay. I believe the last thing we need to do is just discuss self-breast exam. Men do not get breast cancer as often as women, but they can get breast cancer. So just to let you know how to do this exam, you should do it once a month. You can pick any day, but it should be the same day every month. When lying down or in the shower, you can put your arm up above your head, palpate the axillary nodes, and then palpate the breast tissue in a circular motion. Feeling for any lumps or abnormalities there. Okay? And then this arm, palpating again the axillary nodes. And then the breast tissue in a circular motion, moving toward the nipple. You should also inspect your breast. That should be done when you're standing looking in a mirror with your hands on your hips. You should see symmetry. If the nipples are always everted, meaning the nipple is pointed out, it should continue to point out, not have any discharge. You should not see any changes in the skin of the breast. So no, or if you saw anything like orange peel looking skin, you would need to have that evaluated. If you at any point felt any masses or any enlarged lymph nodes, you would need to see your provider. Also, young men have more common testicular cancer than older men, but all men should check their testicles once a month as well. That's done at the same time every month, so pick a day. You could do breast and testicles on the same day, but you're feeling in both testicles for any fluid accumulation or any nodules or masses, any tenderness, anything like that. Okay?
Okay.
If I can get you to go ahead and sit up, I'm going to I can't say the word right now. I'm going to look in your eyes with an ophthalmoscope.
Okay.
And I am gonna cut the lights down for this and kind of turn on some ambient lighting because I want to be able to look, as I look into your eyes, I want to be able to see your retina and look at the back of your eye, looking for the optic disc,
Okay.
any hemorrhages in your eyes. Okay, thank you. Okay. So just look straight ahead at me.
Mm-hmm.
You can see the red reflex. I do see the vessels. I don't see any nicking or any evidence of hemorrhage. Sorry, need a moment?
I'm okay. I'm okay.
Okay. And then on this side. I can see the red reflex. You do have an area that I think may be a little, either an enlarged vessel or possibly a little hemorrhage. Have you had a recent eye exam?
Probably not within the last maybe 6 months
Okay.
to a year.
Well, it's probably about time. Do you go about every 6 months or every year?
About 6 months.
Okay, well, it's about time to do that.
Okay.
So I'd recommend you do that. You have excellent vision.
Okay.
And I don't see anything major. I can't tell for sure about this eye as far as that one vessel goes, but
Okay.
I would recommend you do that. Do you have any questions about our exam today?
I don't.
No?
No, ma'am.
Is there anything we need to talk about?
I'm good.
There's one thing I need to add, and that's that I washed my hands about 4 times before we started, but I don't think I washed them in front of the camera.
Okay.
So, just to verbalize that, okay?
Okay.
I think I'm gonna look over some stuff and make sure we've covered everything. And I believe we have. Thank you so much for participating
You're welcome.
in this
Thank
physical
you.
assessment.